Hello everybody, this is Coding Procedures with Pedro Paul. This time I have another fusion that I'm going to explain to you. It was a posterior-posterior fusion with bone bank, which is a non-autologous tissue substitute. Alright, let's go to the report. I want to explain step by step. Okay, description of the procedure. Patient was taken to the OR and intubated without difficulty by the anesthesia team. The eyes were taped and the ointment was applied to prevent corneal abrasion. Foley catheter was inserted and the procedure started by turning the patient in prone position. Alright, patient is in prone position. This is telling you that the patient is facing down and the approach is going to be from the back. Two things we need to keep in mind: approach and root operation. Right? In this case, the approach is going to be posterior because patient is in prone position, is facing down. Now the patient was prepped and drugged in the standard sterilization, and the skin was open with a number 10 blade. So that's telling us that this is an approach from behind and open procedure. The approach is open. Remember, approach, root operation, two things you need to keep in mind. Okay, the dissection was carried down until the pedicle was exposed. Alright? The pedicle is a portion of the vertebra. It's a portion of the spinal cord that sometimes they use it as a graft. Let's keep reading. Okay, they elevated the muscle and they exposed the fossa on the right and left. Right? They got to the disc, lumbar 4, lumbar 5. This is one level. Two vertebra is one level, one joint. So this is lumbar 4, lumbar 5 space. Right? They check with fluoro and then they drill the lateral transverse process, and partial laminectomy was performed. Laminectomy with forcectomy. This is approach. In this case, they are trying to get to the joint, to the lumbar 4, lumbar 5 intravertebral joint. Alright? They did the laminectomy, approach, forcectomy, took a piece of the fossa, which is a part of the vertebra, and then they're right there in the lumbar 4, lumbar 5, right here. So this space was then cleaned up to here. It's a discectomy. They excise a portion of the disc, utilizing a curette and chambers until the whole disc was exposed. If the whole disc is removed, the root operation for the discectomy is going to be resection. Why resection? Because they remove the whole body part. When the whole body part is removed, you call it to resection. If a portion, the body part, is removed, then you call it to excision. So in this case, the whole disc was removed using chambers and using curettes. Okay, the clean disc space was analyzed for the interbody fusion device, which is the cage. Right? So you have a cage right here for the arthrodesis. Arthrodesis and fusion, same thing. Alright? So right here, up to here, we have a posterior approach, we have a discectomy, and then getting ready to insert a disc. So when the interbody fusion device is inserted, it's always anterior to the spinal cord, right? So in this case, up to here, we have posterior approach, anterior insertion of the interbody fusion device, of fusion, posterior, anterior. Let's go to the next slide. Okay, the procedure continues. Then they use a permanent interbody cage as an interbody fusion device. And it was filled with DBM, right? Demineralized bone material. This is a non-autologous or allograft bone material that is taken from the bank, not from the patient. The patient is autograft, right? Or autologous. When it's not taken from the patient, it's allograft or non-autologous, right? In this case, it's non-autologous allograft material. So they use this material and put it together with interbody fusion device and inserted it in the lumbar 4, lumbar 5 joint. Remember, 2 vertebrae, 1 joint, 1 level. So they inserted it after the discectomy that we read before in the slide before. All right, we keep reading. It fit well, this combination, it fit very well. And after making sure that everything was in good position, the arthrodesis was completed. Now, then we turn our attention to the drill hole. Okay, this is now the posterior procedure, the posterior fusion. Okay, on the fluoro, they use the screw, place into the pedicle. You see pedicle, you know it's already the back of the spinal cord, posterior to the spinal cord. Okay, the pedicle of the vertebral body. We then move to the contralateral side level and repeated the same procedure. A high-speed drill was then utilized to decorticate the bone laterally to perform the lateral arthrodesis, right? The open and decorticated the bone, right? The open holes. Now, these recesses, these spaces or this hole, were filled with allograft bone chips, all right? We stop here for a moment. This is a posterior arthrodesis, right? Lateral arthrodesis, lateral fusion with allograft. Remember, allograft, non-autologous tissue. It's the bone graft that is taken from the bank, right? So they used it posteriorly, right? Then the allograft bone chip were on the fluoro, everything went okay, the wound was closed, they used antibiotic, and closed in layer. So, what do we have here? We have posterior-anterior fusion. Posterior to the patient, anterior to the spinal cord, right? Discectomy. They also did a discectomy. And in this slide, we have the posterior fusion. Why posterior? The access approach was from the back, and they inserted allograft or autograft, allograft or non-autologous tissue in the vertebral posteriorly. All right? So I'm leaving you here the codes of the procedures done. All right, there is one code missing here, which is the discectomy. This was a posterior-anterior fusion of the lumbar vertebral joint with interbody fusion device, right? Posterior approach, anterior column to the fusion. Back of the patient, front of the spinal cord, right? It's only one level, lumbar 4, lumbar 5, right? They use the interbody fusion device, which is always inserted anteriorly, okay? All right, also, I didn't add it here, but you have to call the discectomy. Before insertion of the interbody fusion device, they remove the disc, which is a resection, total resection. Complete body part is a resection. A portion of the body part is an excision. Before insertion of the interbody fusion device in the lumbar 4, lumbar 5, they did a discectomy. It should be added here. I didn't put it, but it should be added here. And then they move to the back of the patient, right? And they did a posterior approach, posterior insertion of a non-autologous or allograft fusion device, right? So they didn't harvest any bone from the patient from this procedure. They took the bone graft, demineralized bone graft from the bank, and they performed the fusion posteriorly for this patient with bone graft, no bone from the patient, from the bank. All right. So you have posterior fusion of lumbar vertebral joint with non-autologous, same as allograft, tissue substitute. Open approach, they open the patient posteriorly, lumbar 4, lumbar 5. All right, that's it for this procedure. Remember to add the discectomy here for the posterior-anterior fusion. I didn't add it here, but you should. It was a procedure that you should go besides these two procedures. All right, family, if you like the video and if you have any question, leave a message and subscribe. If you want to know more, if something I can help you with or I can clear any question, just subscribe. And then thank you for watching my video, and I see you in the next video. Thank you very much.